Hello and welcome back. Today we're going to be talking about birth-related traumas and how to move through this, how to move past it, understanding what is a birth-related trauma, the healing process, building the support network to help you heal in this way, and also preventing the future trauma with future births. And also some future stories and talking about how storytelling and actually sharing this actually helps in moving past the traumas. I'm stoked to get into this. Please, if you guys haven't done so already, share this course and lead the world's transition with me to a fertile and healthy future. So let's dive into it. What is a birth-related trauma? This could be physical trauma. It could be maternal injuries, such as perineal tears, pelvic floor damage, or injuries from surgical interventions, such as cesarean sections. There also could be a neonatal injury where the infant may experience physical trauma, such as a shoulder dislocation, fracture, or neurological injuries, often related to a difficult delivery or the use of forceps or vacuum extraction. And there's also psychological trauma, and this may arise when there's complications that's encountered throughout the labor, such as a post-traumatic stress. Women can develop post-traumatic stress following a birth experience, characterized by intrusive thoughts, nightmares, and emotional distress. And also anxiety and depression. Many women report heightened anxiety after or during pregnancy, and some can experience the postnatal depression, which can stem from feelings of helplessness, fear, or perceived lack of support during childbirth. So let's talk about birth-related trauma. The types of trauma is perinatal trauma, and this type encompasses both the prenatal and postnatal periods, highlighting the experiences that occur before, during, and after childbirth. Then there's the obstetric trauma, and this is specifically referring to injuries sustained during labor and delivery, oftentimes resulting from complications or interventions that were necessary for the safety of the mother or the baby. And then there's also emotional and physiological trauma or psychological trauma, and this relates to the feelings and the psychological impacts associated with childbirth that can include fear, helplessness, or a severe loss of control. The common causes of birth-related trauma. This is essential to understand so we can prevent it in the future. It can be complications during the labor and delivery, situations such as a prolonged labor, fetal distress, or the need for emergency interventions can create traumatic experience for the mother and the family. And lack of support during childbirth. A perceived absence of emotional or physical support during labor can intensify feelings of helplessness, contributing to trauma experienced. And also previous traumatic experiences. So women with histories of trauma related to previous or other life experiences may be susceptible to experiencing trauma during childbirth. And now I want to talk about the symptoms of trauma. So physical symptoms, women may experience physical symptoms such as pain, fatigue, and other stress-related ailments that can actually hinder your recovery and affect your daily life. There's also emotional symptoms such as flashbacks or traumatic event where there's heightened anxiety, irritability, mood swings, which can disrupt the woman's emotional well-being, and also behavioral symptoms. They can manifest of trauma such as an avoidance of the situation that trigger memories of the birth experience, societal withdrawal, and difficulty maintaining relationships. So I want to get into the healing process, and I really don't feel this is necessary for every woman to watch in your preparing for postnatal. And I also don't feel that if you had a traumatic birth that you need to dive into any of this discussion at this point in your healing or recovery. I only have this available for women who are seeking some support or reprieve who did experience some sort of trauma throughout their birth. So now that you have kind of heard the intro, I want you to decide based on your experience with your birth whether you want to continue to learn it, lean in and listen and help calm the nervous system, calm your body from the experience that you had. Or if you don't feel this is pertaining to you, then I ask that you don't watch this video, because it's not worth your energy, thoughts, time, and attention pouring into this course at this point in time in your life. So decide whether you feel this is going to be helpful for you. If you experience some type of trauma, I invite you to stay along with this, lean in, listen, and be willing to start to heal from some of these experiences so you can actually help your recovery. All right, so first step to healing in our process of trauma is to actually acknowledge the trauma. We need to actually step into the experience that happened again. And this recognition and validation for the emotions that you're feeling, for what you experienced, is essential for us to be able to move on and recover. So the first step is to recognize and acknowledge. Understand the impact. Recognize trauma is essential because it helps individuals understand their experiences are valid and they're not something to be minimized or ignored. Validating one's feelings and experiences can foster a sense of empowerment and control. Breaking the silence. Many women feel ashamed or isolated due to their traumatic experiences. So open acknowledgement can break the cycle, the silence, and the stigma, enabling a community of support. And facilitate healing. So acknowledging the trauma can initiate the healing process by allowing individuals to confront their feelings and experience and pave the way for future therapeutic interventions. And we want to create a safe space for discussion for these experiences. So why I took that pause in explaining, like, please don't join if you don't feel you had a traumatic birth, is because I really don't want to bring people's headspaces, our women's headspaces, into the place of feeling that they need to hear about trauma, because I don't feel that is really that beneficial. But for the women who have experienced trauma, it actually is beneficial for them to have a soundboard to go to share their story, to see, to feel, to know that they are validated in their emotions, in their experience, so they can move forward in recovering. So the safe space to discuss are supportive environments. So finding group places that can join and share their experience, and then also learn how to build that safety in them, release that old story, expectations, allow it to leave the body, ask for your body to get what it needed in that time so you can actually close that circle and not stay left in that pain, left in that problem. All right, so the supportive environment is essential. Finding this place where you can freely express your emotions without judgment, and also feeling that these people know how to support you in healing from this experience. It should be encourage open communication. So facilitating open discussions about birth experience could include sharing experiences in supportive environments or support groups or therapy. And then you can use guided imagery to help course correct the story, bring in the needs that you needed to be met. And this can actually help heal from the trauma in a way that you actually need to carry on. So coping strategies. We can use mindfulness and relaxation techniques that we talked about before. And this is going to help with like your breath work, regulating the stress, regulating the anxiety. You can learn different techniques like using this progressive muscle relaxation by your squeezing and activating, and then using your body, your mind, your visuals, the guided imagery to allow this physical attention to leave your body. We can also use journaling and expressive writing. This is a really wonderful way to connect with our subconscious. If you don't have the support groups or you don't know where to find that connection of someone who can give you the support that you need, to have a journal and write out your feelings about what happened during your experience. This allows you to articulate your emotions and to also process them, like literally shed the tears, allow yourself to connect back to those feelings, going into them. Structured writing exercises may be an option where you're actually using prompts relating to the birth experience to allow yourself to go into the memory and write out and explore your emotions in a place of safety without feeling like you need to suppress them. And then physical activity and self-care. So exercise as healing, using movement is actually going to help you improve your mood, reduce your anxiety, promote your overall well-being. And your self-care, like giving yourself the rest you need, the nutrition you need, and spending time in activities that you find enjoyable, all can be helpful for your recovery. Your support network is huge when you're trying to move past a trauma. And I shouldn't even say like you're moving past, but you're kind of moving into a trauma. And if you're not moving into the trauma, then you're probably likely going to be re-triggered from this event at some point in your life. So a big part of a coaching program that I do with my clients one-on-one is teaching them how to actually move into the trauma and sit with the emotional unmet needs and hear and feel their emotions. And once they're able to do that, they can clear them, and it no longer is going to impact their mental headspace and their physical recovery. So the social network is huge. Your community and how they're all going to come and help and be there for you to support you in this time. So your family and friends can offer you this emotional support, give you this listening ear, this validation, and it's vital when you are talking and opening up to somebody in this place of trauma that there's somebody who can actually hold the space for you. So what isn't validating for you is to tell your best friend or your sister and for them to say, oh, it happens to everybody, don't worry about it, it's done. Or, oh, you can't get hung up on that kind of stuff. This kind of friendship or emotional support is really not going to give you the tools and techniques that you need to move into the trauma, to actually heal from it. So you need to ensure that the people you're choosing in this community support when you're talking about trauma-related events is going to fully understand and validate you and hear for you and just allow you to be in that emotion without them correcting it or course changing or doing anything else. Just actually being present with you would be really helpful. So they can also help you. If they're not that support system for you, they can also just help take off the day-to-day stressors. So your household, your meal preparation, your childcare, and just give you the space and time to actually do the healing, to actually go back into the trauma, to go into that space, which is going to take you away from spending time with a baby or cooking and cleaning the house. The encouragement of self-care is necessary. So having people in your circle who know how important it is for you to do this work, to do stuff on the inside, to take care of your health on the outside, to take care of your nutrition, your mindfulness, your wellness, those people are really going to play a key role in this time. Peer support groups, this is going to be helpful for you during this time. Creating these shared experiences, the connections are sometimes really helpful for people to hear. I was actually in a peer support with a group of women where we were all sharing our birth experiences. And while I was able to hear and experience and support ladies who experienced euphoric free births, I also was able to relate to the woman who only experienced this birth as a cesarean, and she felt this missing out on motherhood in a way. She didn't feel she was a mother in a way. And as she was talking and telling her story, it foreshadowed or brought me back into a birth trauma I experienced with a cesarean as well. And so we can learn through each other, we can connect with each other, and we can actually bond in that way together and build these lasting bonds. So people who join these support groups are there for each other as they know that would be supportive for them. So they're almost giving the care that they need, which is really helpful. When somebody hasn't gone through this birth trauma, which is why I asked ladies who didn't experience this to not stay and participate, is because if you haven't experienced it, you don't or may not know how to hold space or how to be emotionally available for somebody who is processing this. So just being around people in that similar situation can be really helpful and nurturing to you and allow you space to heal. All right, how are we going to prevent future trauma? So education is key. Education is probably the best thing that we can do, is take more of our power back and know why you're making decisions, and know why you say no, and know why you ask questions. And so prenatal classes and other resources are really helpful for that, to understand the birth process, to know what's happening in labor, what's happening in your delivery, how your body is actually responding to different chemical messengers, how the baby is responding. For me, when I fully understand the physiology of what's going on, there was no more fears for me around birth. And that was huge for me, preventing the future trauma from happening. And also, once you've been through birth, then you know what matters to you and why it matters to you. So from my first birth to my second birth, I knew instinctually I wanted the birth this certain way, but it wasn't until I went through it that I then saw how I felt like I was not seen, not heard, not taken care of, not respected, not validated, and basically I was not listened to throughout my delivery process. So that's part of it, is learning the process of birth, learning the process, and then knowing and standing firm into why you're making the decisions you're making in the future. Learning coping techniques. So classes that can help teach pain management, like relaxation techniques, breathing techniques, visualization, movement options. These are going to give you more control in your labor process. You're going to feel like you know what to expect. You know how to avoid some of these things. And also you know how to trust your body. One of the ways I like to frame how we decide to make moves, empower ourselves, get more knowledge, is if we're moving into something because we're fearful of the pain or we're fearful of the unknown, then we need to educate ourselves. So we're moving into the space of the known, so that way we can actually get the outcome that we desire. So focusing our attention on the outcome we desire instead of focusing our outcome on the fear that we are trying to avoid. Does that make sense? Educational materials can be really helpful. So just videos about childbirth, videos about pain management, videos about breastfeeding, understanding why you're making the decisions you're making is going to be really helpful for preventing future events. And then birth plans and communications with providers. So the birth plan is essential. And remember, I said it's essential not for your provider, because they might not be the one to listen to it. It's essential for your support team who's with you, and for yourself. So when you're sitting there and you have a birth plan all thought up about how you want to be taken care of during your labor, how you want to be taken care of during the baby's delivery, what you want to be done to you, yourself, and the baby in the postpartum window, is all really helpful to feel prepared. And also knowing that that is your responsibility to upkeep those principles, right? Like, it's not naturally given to you because you wrote it down on a piece of paper. It really isn't. It's given to you because you continued to be an advocate for yourself. So being an advocate with yourself and using these tools like a birth plan, using open dialogue, using realistic expectations are all tools that you're going to have to learn to prevent from something like this in the future. And I'll tell you a story. It wasn't until I went into my second birth, when I really wanted to have a natural vaginal birth, that I came to the table with my provider with a completely different level of authority, of empowerment, and a decision that I made. This is the decision I made. I want this. And also, if you can't help provide that environment for me to be able to birth my baby naturally, then I'll find another provider. And I just knew what I was going to have, and I knew what I wasn't going to have. And I knew what I was willing to give up, and I knew what I wasn't willing to give up. So at that time, that my mind was set. And also understanding what it means to have informed consent. This is oftentimes actually not being practiced in different hospital situations. Medical procedures and interventions have to have informed consent. And so this means that there's clear expectations of the procedures that's going to be done. The provider should explain to you every risk and benefit of an induction, of an epidural, of a cesarean in detail before having you make any decision. And they also should give you alternatives to make an informed decision. That's what informed consent means. It means you have the ability to know the risk, to know the benefit. The risk of having a cesarean is you could have internal bleeding, you could have, the list goes on, risk of infection anytime I cut through you, risk of, your baby because they're not coming through the vagina, risk because of, go through all the risks. And then go through the pro. The pro is you get to have your baby in 30 minutes. That's the pro. Like, you can then make your decision based on the risk and the benefits. And then also, if you don't want to have the cesarean right now, then what we can do is then you list alternatives. And then I have the ability to make my decision for myself. Consent for every step. So when interventions become necessary because somebody's health is at risk, every single step of the way, you have a chance to pause and ask questions. What are the risks? What are the alternative options? And what are the benefits? And then make a decision from there. And advocacy for patient rights during labor and delivery. So encouraging your self-advocacy. This is a really hard time when you're birthing, when you're tired, when you're having contractions and surges to come back into your brain and make a really good informed decision for yourself. So that's why it's important to have birth doulas or your partners or your support people around who fully know and understand what you want, because they can help step in as the buffer. They can step in and communicate with the providers. Respecting patient autonomy, healthcare providers must honor patient autonomy by acknowledging that each birth experience is unique and that patients have the right to be active in their decision making. Respectful care helps reduce the likelihood of trauma by creating a sense of security and control. All right, then as you have experiences in the past, how do we avoid it going forward is we pick and encourage supportive birth environments. So maybe what you experienced was that you didn't have the support that you wanted. So the next future birth, you're going to ensure that you have it by looking into this. Continuous labor support. So the role of a birth partner and or a doula, how they can help give you that emotional support, help with physical recovery. This can help with all of your decisions around your birth in the future. Support from medical staff, so the people who are actually giving you reassurance and guidance and empathetic care, you can accept them into your room. And the ones who are not listening to you, who are not honoring your needs, you also have the right to ask them to leave. You also have the right to ask for a different doctor. You don't have to stay. You don't have to allow them to be in your space if they're not actually pouring into you. And the benefits of continuous support. So research shows that continuous labor support improves birth outcomes, reduces the need for interventions, and increases the overall satisfaction with your birth experience. Personalized care and attention. So customizing a birth plan and making sure that you are in a place where somebody feels comfortable to allow you to achieve the birth that you want. Emotional attunement, by tuning into the emotional needs of the birthing persons. The providers are going to help respond to distress or anxiety and with empathy and compassion. And flexibility and adaptability. So personalized care allows that you to change your mind, express your needs. And so having the conversations with these supportive birth environments is, am I allowed to change my mind? What if I decided I wanted to have this natural childbirth and I really decide I don't want to, and I'm dilated to a 9 and I really want an epidural? Can I change my mind? And your doctor's like, yes, of course. Then this might be the perfect environment for you to stay and birth. All right, so I'm going to get into my personal story, and then I also want to talk to you about the purpose of sharing stories and how they can help us in our healing. And I am sharing this experience as an opportunity for you to go through your birth experience with yourself and heal from it using the techniques and tips that I use for helping hundreds of my clients. So, first experience is to actually go back into the event of trauma. And I actually just decided not to share my birth experience with you now, as I was planning to. But I don't want to share the whole thing in detail. I would rather have me walk you through the steps of how I healed from it, okay? And my reason why I had trauma with my first birth was because I had a prolonged birth, where I was checked into the hospital too early because it was a holiday. And then I kept kind of allowing some medical interventions to take place. And due to a language barrier, I didn't really fully understand what I was agreeing to. And the doctor wasn't fully able to tell me what the procedure would be like. And I also didn't know I had a choice. So for me, that's why these pieces of the trauma come in, and they're so important, because now I know what to look for in a supportive birth environment. Now I know that I do have a choice, and now I know I can say no to doctors and physicians who are not supporting me in my journey. So, knowing these events, I want you to practice going into your birth trauma if you feel comfortable with doing that with me right now. And you're going to close your eyes, fully allow yourself in a safe space. So first, setting up a safe haven. And a safe haven is, in your mind, setting up the ideal environment that makes you feel so cozy, so supportive, so present in this place in your body. So would it be like, I'm in a room with silky sheets, I'm out by the water in Hawaii, I'm at a Rainbow Falls, I'm in a cave, I'm in my bedroom, I'm at my house, and I have my friends and family around. Whatever is your supportive environment, that safe haven, where you can feel comfortable to relax into your story. Okay. Next, you're going to go into the story and start to allow yourself to replay this event in your body. So imagining the sounds, the smells, the colors of the room. Who is in the room with you then? Allow yourself to get really present in that moment. And then imagine that pain point, this moment in your journey that felt really uncomfortable, or maybe you let your guard down, maybe you didn't stand up for yourself, maybe you didn't speak your truth, your concern, whatever it was. Allow that story to play out here for you in your third eye, in your memory. And now, any of the emotions that come up with it, this is a time to actually let them out. So to feel them fully and to let them out. So you want to cry, you want to scream, maybe you're even feeling that you're holding the tension in your body. So yawning, burping, purging, crying, this is all really normal. It's your body actually releasing that stored trauma. And I want you to stay in this emotion as long as you need. And not until your body, not my tone, not me repeating, not me talking to you. As soon as your body is actually ready to move from the emotion, then you're going to carry on with this recording. And if right now you're still purging, you're still cleansing, you're still clearing, stay here, hit pause, and come back when you're feeling your body wants to move forward. Like you're done reliving and staying in the emotion. You're wanting to take a step forward. So we might be doing different things here, either hitting the pause button and feeling into the emotion, or we're ready to step forward. So now I want you to imagine or ask yourself in this moment, what was my need right now in this moment of distress, of discomfort? Do I need some validation? Do I need to feel heard, seen, respected? Was there some physical securities that weren't being met? I wasn't comfortable. I needed food, I needed water, I needed shelter. What is it? Was it love? Was it trust? You're not feeling trusted or they're trustworthy? Did you need time? Did you need a chance to talk about things to flush this out fully? Were you rushed to making a decision? Now allow yourself, when you're able, to put your finger on what would feel good for you in this birth experience. Maybe it's you wanted some validation for your emotions. So I want you to imagine everyone in the room who's there, your care team, your support, to look at you, looking you in your eyes, validating your emotions. I see you. I understand why you're so scared. I understand why you're upset. I understand why you don't want this. Do you want to explain it more to me? Allowing the conversation to play out. Allow yourself to have this need fulfilled. And if there's more than one need, I want you to take the time to go through the multitude of things that had transpired. So maybe you didn't feel heard, maybe you didn't feel listened to, maybe you didn't feel validated. So you need to go into each of these emotions, giving yourself this level of security and safety and trust in a way that allows your nervous system to relax fully. Maybe it was trust, and if it's trust, it's imagine yourself having a fully trusting relationship with your provider, with your partner, whatever it is. Allow your body to relax in knowing that this desire has been fulfilled. Scan through your body, recognizing if there's any more pain or tension or holding in your body around the trauma of your birth story. Playing that out in your head, allowing your body to respond. Scanning through your body and noticing when it feels ready to move from this emotion, you can stay in this emotion. Stay in this new vision of you allowing these needs to be fulfilled. And when you're ready, you can go into your safe haven. Your safe haven, your cozy place where you feel safe, secure, seen, held, loved, trusted. It's a place for you to relax. I want you to imagine returning the piece of you that felt broken, that felt torn apart, took apart, separated from that piece of your identity. Imagine this peace coming to your body, to your being, and completing you, bringing you back to wholeness. I want you to imagine a waterfall, or a shower, a warm shower, a hot bath, a soaking tub, some sort of water to cleanse you, to purify you from that trauma. Imagine drinking the water, cleansing yourself from the inside out, and releasing the old story, the old belief from your body, from your being, and allowing yourself to be in the vibration of peace. Coming back to your adult body, coming back into this moment, taking a breath with me, coming back into this space. So I welcome you to practice this routine of going through your body itself, allowing yourself to heal by actually seeing these needs be fulfilled. I welcome you to share your experience by voicing it through storytelling, or if you're really wanting to heal, going back into this moment, going back into your body, creating the safe space so you can actually fully heal from the inside out. Because talk therapy, voicing, telling stories, having communication, talking about our story can sometimes just reopen a wound. But what we want in the trauma is to actually have the healing so we can move forward in a different state, in a state of completion, in a state of feeling whole, in a state of feeling renewed, instead of staying in the old story of feeling broken. So I'm welcoming you there, practicing this, repeating this section of scanning through your body, of going through and creating that relaxation in your whole entire body, into your whole being, where you were seen, you were respected, you were cared for, your baby was safe, you were safe, you felt safe. All of your emotions were in alignment. You were freely able to express yourself. You were able to be exactly who you are. You were actually heard when you spoke. You were asked if you were okay. You were also asked if you needed something else different from the decision you made. Feeling how good it feels in your body to be fully respected, fully seen, and fully cared for by the staff, so you could be in a place of ease and comfort and enjoy the pregnancy the way you have always imagined it. Thank you so much for trusting me, for diving into your trauma. If you have questions around healing, of entering into this, and you're wanting to do more of a deep dive into handling, to looking at the trauma so you can move from it, move forward from it, not stay buried in the past, then I ask you to reach out, direct message me, talk to me about doing coaching one-on-one and working together so we can move past that pain point and you can really start to recover physically, mentally, emotionally, and beyond just recovering. Start the deep bond that is awaiting for you, and you with yourself, you with your baby, and you with your partner who you are embarking this journey with. I'm grateful for you being here today. Enjoy the rest of your beautiful day. Ahui ho.